Selective mutism is a rare childhood disorder that is characterized by the persistent failure of speaking, even though fully capable, in contexts where speech is typically expected. It is classified under the category of disorders first diagnosed in infancy, childhood, or adolescence. Another way to describe selective mutism is when they have an intense fear of speaking and socially interacting when there is the expectation to communicate. Some symptoms or signs include consistent failure to speak in specific social situations, interference of educational or social communication achievements, and failure to speak is not because of lack of knowledge. Some causes for selective mutism include premorbid speech and language problems, inherited tendency to be anxious or have severe anxiety, and hearing difficulties. Children could also be at risk depending on the environment put in and how others react to them. Children may also be at greater risk if they also have sensory processing disorder. The prevalence of selective mutism occurs between the ages of 3 and 6, but diagnosis occurs between ages 5 and 8. Selective mutism is slightly more common in girls and range in people who have this disorder vary because of rarity and severeness. The range could be between 0.47% to 0.76% of children who have selective mutism. Selective mutism cannot be diagnosed until disorder symptoms are presented for a minimum of 1 month. One of the most popular diagnosis methods is direct observation done by a clinician. This method helps rule out other conditions or disorders that impede speech. Treatment for selective mutism is usually either non-medication or medication-based interventions. With medication-based options, we usually supply serotonin reuptake inhibitors. For non-medication methods, we usually use self-modeling or psychodynamic therapy. Treatments can be difficult to generalize given the rare nature of the disorder. More than 90% of children with selective mutism also have social phobia or social anxiety. If you have any more questions or concerns about selective mutism, check the Additional Resources tab on our website.